Tooth extraction is recommended when a tooth is severely decayed, fractured, impacted, or causing crowding. Left untreated, infection can spread, bone is lost, and neighboring teeth shift. Sometimes it causes systemic health risks such as systemic infection bacteria in bloodstream that threatens your life, and chronic diseases like heart disease and diabetes. If possible, teeth should be saved even with root canal treatment or orthodontic repositioning. You will be informed about the alternatives as long as they can be considered for your case. After any extraction, some degree of pain, swelling, and bruising is completely normal and managed with medication and cold compresses. Prolonged bleeding beyond the first few hours should be reported. Patients should bite on gauze firmly and call us if it recurs overnight. Dry socket days 3-5 occurs when the blood clot dislodges, exposing bone and causing significant pain. High risk in smokers and wisdom tooth cases. Avoid straws, smoking, and vigorous rinsing. Nerve numbness or tingling is usually temporary but rarely permanent with lower wisdom teeth near the inferior alveolar nerve. Once it happens, you should wait weeks to months until it heals. Sinus communication can occur with upper back teeth whose roots sit close to the sinus floor. It typically heals on its own with precautions, no nose blowing or sneezing or cough. Incomplete extraction may happen when roots are curved or fused to bone. If removal poses greater risk, the fragment may be left and monitored. Patients will always be informed. Simple extractions take 5 to 15 minutes. Impacted wisdom tooth removal is a surgical procedure requiring incision, bone removal, and sutures, typically 20-45 minutes. Both are performed under local anesthesia. You will feel pressure but not pain. Wisdom tooth extraction is a high-risk dental procedure. Beyond common complications like bleeding and swelling, rare but serious risks include reinfection, jaw fracture, damage to adjacent teeth or restorations, sinus perforation leading to sinusitis, and nerve injury causing numbness. Waiting until infection forces removal dramatically increases these risks, and healing may be delayed or incomplete. Infection can even spread to the neighboring molar, requiring simultaneous removal. Because complication rates rise with age, we recommend a panoramic X-ray evaluation around age 20 and preventive removal before problems developed, even when there are no symptoms. Following these instructions will significantly reduce your risk of dry socket and infection. The most critical step is hemostasis. Bite firmly on the gauze for 2 hours to ensure proper clotting. A cold pack can help with swelling and discomfort. The doctor may also prescribe medications as needed. Before you leave, we'll review all post-op instructions with you once more. For impacted wisdom teeth, expect 5 to 7 days of discomfort and up to 4 weeks for full tissue closure. If complications arises, you will follow these rules. Dry socket, throbbing pain and bad odor around days 3-5. Coming for a sedative dressing. Resolves in 7 to 14 days. Nerve numbness beyond 2 weeks in the lip, chin, or tongue. Report to us for monitoring or specialist referral. Bleeding beyond 2 hours of gauze pressure, call us immediately or go to emergency. Infection, fever, spreading swelling, or pus after day 3. Don't delay. Antibiotics or drainage may be needed. Sinus complication, air or fluid between mouth and nose, means a return visit is required. Tooth replacement, once healed, consider an implant, bridge, or partial denture to prevent bone loss and bite changes.